Edutainment Studios welcomes you to Age-Related Macular Degeneration, Understanding It and Living with It. This module is part 2 of a 5-part series on age-related macular degeneration. In some people, AMD, or age-related macular degeneration, advances so slowly that vision loss does not occur for a long time, while in others, the disease progresses faster and may lead to a loss of vision in one or both eyes. As it progresses, a blurred area near the center of vision is a common symptom. Over time, this blurred area may grow larger, or you may develop blank spots in your central vision. Objects also may not appear to be as bright as they used to be. AMD by itself does not lead to complete blindness with no ability to see. However, the loss of central vision in AMD can interfere with simple everyday activities, such as the ability to see faces, drive, read, write, or do close-up work, such as cooking or fixing things around the house. In this course, the objective is to help you learn the symptoms, signs, and causes of age-related macular degeneration. AMD usually produces a slow, painless loss of vision. However, in rare cases, vision loss can be sudden. The dry type of macular degeneration often causes slightly blurred central vision, both close up and far away. The center of vision may become fuzzy or shadowed, growing larger as the disease progresses. Blind spots may develop, with difficulty seeing color and fine details. In wet macular degeneration, straight lines may appear wavy. And in this more severe form, central vision loss can occur rapidly, sometimes within days or weeks. AMD can cause a variety of symptoms that can affect daily life. Visual field defect. The wide angle of vision that a healthy eye can see is called the visual field. As AMD progresses, the center of your visual field may become smudged, distorted, or lost. This defect causes difficulty with reading, driving, watching TV, and recognizing faces. Contrast sensitivity. It becomes more difficult to see textures and subtle changes in the environment. If you become unable to see slight contrasts and textures in pavements or stairs, it can be dangerous and lead to an increased risk of falls. You may have difficulty distinguishing between two colors of a similar hue when placed side by side. It may become difficult for your eyes to adjust when driving and walking at sunset, or when going from a well-lit room to a darker one. Glare can worsen the problem. For example, a bright shaft of sunlight streaming in through a window may cause everything outside the glare to black out. You may find that you need brighter light levels for reading, cooking, and performing day-to-day tasks. An inability to properly judge distances can also make walking harder, potentially leading to missteps and falls. Eye care practitioners can often detect early signs of macular degeneration before the symptoms appear. This is usually accomplished through a retinal exam. When macular degeneration is suspected, a brief test using an Amsler grid that measures your central vision may be performed. If your eye doctor detects any defect in your central vision, such as distortion or blurriness, he or she may order a fluorescein angiography to examine the retinal blood vessels surrounding the macula. Though macular degeneration is associated with aging, some research suggests that there is also a genetic component to this disease. Researchers have noted a strong association between the development of AMD and the presence of a variant of a gene known as complement factor H, or CFH. This gene deficiency is associated with almost half of all potentially blinding cases of macular degeneration. Investigators found that variants of another gene, complement factor B, may be involved in the development of AMD. Specific variants of one or both of these genes, which play a role in your body's immune responses, have been found in almost 3/4 of the AMD patients who were studied. Other research has shown that oxygen-deprived cells in the retina produce a type of protein called vascular endothelial growth factor, or VEGF. This protein triggers the growth of new blood vessels in the retina. The normal function of VEGF is to create new blood vessels during embryonic development after an injury or to bypass blocked blood vessels. But too much VEGF in the eye causes the development of unwanted blood vessels in the retina that easily break open and bleed, damaging the macula and surrounding retina. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 2 of 5 on age-related macular degeneration, and please join us for Part 3.